Transitioning into hospice care can be a difficult and emotional process for both individuals and their family members. It is important to understand what hospice care is, why it is beneficial, and the different considerations when transitioning into hospice. Hospice care is a specialized approach to end-of-life care that focuses on providing comfort and support to those facing a terminal illness or condition. It encompasses different types of care, including physical, emotional, and spiritual support. Transitioning into hospice care involves preparing for and accepting the end of life, allowing loved ones to process their grief and make transitions smoother. The decision to transition into hospice can be a difficult one, as it involves preparing for death and embracing a new way of life. However, it also brings many benefits for both the individual and their family members, including physical, emotional, and spiritual support. This guide will provide an overview of transitioning in hospice, including its history and development, types of care offered, considerations when deciding to transition, and ways to support those in hospice care. History and development of the concept of transitioning in hospice. The idea of transitioning into hospice care has evolved over time and is now an accepted part of end-of-life care. In the early days of hospice care, the focus was primarily on providing comfort and dignity to patients. However, as time progressed and new evidence-based approaches to care became available, transitioning into hospice care began to be seen as an important option for individuals to consider. Today, transitioning into hospice care is a multifaceted approach that takes into consideration the physical, emotional, and spiritual needs of a patient. It is a holistic approach to care that involves a team of healthcare providers, including doctors, nurses, social workers, chaplains, and other professionals. In recent years, the concept of transitioning into hospice care has become increasingly popular due to its multifaceted approach and emphasis on quality of life. Hospice organizations have implemented a variety of approaches to care, such as palliative care, hospice care, and home health care, allowing patients to receive optimal care in whatever setting best suits their needs. As the demand for hospice care has grown, various organizations have developed different models of care to provide the best possible outcomes for patients and their families. These models are tailored to meet the individual patient's needs and can include such services as bereavement support, spiritual counseling, pain management, and more. Types of care offered in hospice. Hospice care is a type of end-of-life care designed to provide comfort and support for those living with terminal illnesses. The goal of hospice care is to help individuals and their families cope with their illness and spend their last moments surrounded by supportive and caring individuals. Hospices provide a wide variety of services which differ depending on the individual's needs. The type of care offered in hospice can include the following: medication management, to ensure medications are taken correctly and to minimize side effects; pain management, to help control pain and physical symptoms associated with the illness; spiritual counseling, to help the individual and their family members find peace and strength in the face of death; social work services, to provide emotional support for those dealing with a terminal illness; nursing care, to oversee physical well-being and ensure that medical needs are being met; dietary services, to provide nutritional advice and food recommendations based on the individual's condition; caregiver support, to assist family members or other caregivers who may be overwhelmed or feeling overwhelmed; hospice volunteers. To provide companionship and additional support, hospice care is tailored to the individual's needs and can vary in the types and amount of care provided. This type of care can be vital in providing comfort, support, and dignity during the final stages of life. Challenges faced by patients. Transitioning into hospice. Transitioning into hospice care can be a difficult and overwhelming experience for many patients and their families. There are a lot of adjustments that must be made in order to ensure the best care for the patient, including changes to medication routines and other treatments. Additionally, there may be an emotional strain on family members as they try to provide the necessary support. Some of the challenges faced by patients transitioning into hospice include adjusting to new medication routines. It is essential for patients to follow the prescribed medication plan in order to manage pain and other symptoms. This can be difficult for some, especially those with limited mobility or understanding of their condition. providing emotional support. While medical care is important, it is equally important for family members to provide emotional and psychological support. This can be overwhelming for caregivers as they try to balance providing care while dealing with the patient's deteriorating condition. Managing financial implications. Transitioning into hospice can cause financial strain on both patients and their families. This is due to the cost of medications, equipment, and other care needed to properly manage a patient's health. Navigating end-of-life legal issues. Many patients must consider end-of-life legal issues, including advance directives and other important documents. Making these decisions can be difficult, particularly when faced with an illness. By understanding the challenges that may arise, individuals and families can better prepare for transition into hospice care. This helps to ensure the best possible outcome for the patient, as well as providing much-needed peace of mind. How to cope with caring for a loved one in hospice. Caring for a loved one who is transitioning into hospice is a difficult process. It can be both emotionally and physically draining, leaving you feeling helpless and overwhelmed. That is why it is so important to have strategies and tools that can help you cope during this time. Here are some research-backed coping strategies that can assist individuals caring for their loved ones transitioning into hospice. Stay connected. Make sure to stay in touch with family and friends who can offer emotional support during this difficult time. Even if it's just a few minutes on the phone or a quick chat online, having social connections can help ease some of the stress and loneliness. Reach out for help. Don't try to do everything yourself. Ask for help when needed. Many hospice centers offer support programs for caregivers, including counseling, education, and respite care. Take care of yourself. It is easy to forget about your own needs when caring for another, but it is important to remember to take time for yourself as well. Take breaks from caregiving and allow yourself to rest. Exercise and eat a balanced diet, get plenty of sleep, and continue to practice any hobbies or activities that bring you joy. Prepare for the end. Loss is inevitable. Preparing for the end before it happens can help make the transition easier. Talk to your loved one and ask them how they want their end-of-life care to be handled. This will give you direction and make decisions regarding medical care easier down the road. Seek out support services. If the burden of caregiving has become too much, don't hesitate to seek professional help. Hospice centers and other local organizations often have trained staff that can provide emotional and practical support. It is normal to feel overwhelmed while caring for a loved one in hospice. Knowing the right coping strategies can help you manage the situation with greater ease. It is also important to remember that you are not alone and there are resources available to offer support. Conclusion. Transitioning into hospice can be an emotional and difficult time for individuals and their loved ones. This guide has aimed to provide a comprehensive overview of the topic, from the history and development of transitioning in hospice to the types of care offered and the benefits that can be experienced by those who transition in. It also highlights the importance of asking questions and understanding the challenges faced by those transitioning in, as well as offering helpful suggestions for family members and friends on how to cope with the situation and show support. Finally, the guide provides an extensive list of terminology related to the topic. For those seeking additional information, there are many reliable resources available, both online and in person. Hospice services will often provide counseling and support to families and patients, and there are many organizations dedicated to connecting individuals with the support and information they need. We hope this guide has provided the necessary knowledge and resources to better understand transitioning in hospice and the care you or a loved one may experience in this stage of life. Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief.